Well, as we have seen in other countries, government involvement in healthcare has more to do with control than it does with improving a service. Proponents of Obamacare brush aside any suggestion that it will have a negative effect on our physicians and the medical field as a whole. But these are real concerns. And I'm pleased to welcome Dr. David Stevens, CEO of the Christian Medical and Dental Association, to the broadcast. CMDA is the nation's largest faith-based organization of doctors, representing 16,000 members around the United States. And Dr. Stevens joins us by Skype. Dr. Stevens, welcome to the program.
Great to be with you, Tony.
I just want to ask you, first off, it was brought up earlier in the program, about the impact that this is having already on the healthcare field in terms of young people, all these questions surrounding it, whether or not they're thinking twice about entering into this, this great profession of healthcare.
Well, it is. In fact, 62% of doctors, if Obamacare passed, said they would not even recommend to someone that they go into health care because of the tremendous control that was going to take place. One of the things that drives up cost to me is the bureaucracy that we've created. When I was a child, you went to the doctor and there was a nurse at a receptionist at the front desk and a nurse in the back. Now we have a dozen people filing insurance and dealing with the government. And this now is actually causing more problems with this mandate. We've got 3,425 new mandates, 10,000 pages of regulations, 43 entitlement programs that are created. Doctors are spending more and more time dealing with the bureaucracy and less time to take care of patients, and that's leading to dissatisfaction. With the new mandates, all sorts of things are coming down. One of them states that if you have a patient with a chronic disease, you must see them every 3 months. I have high cholesterol. I don't really need to see the doctor because it's controlled except once a year, but now it'll be mandated that has to happen. New standards of care, cookbook medicine. Everybody has to fit the same mold, and if you don't follow the standards of care, you can be sued if something goes wrong. And already we're seeing some of this happen in primary care, where only one medical student out of 50 is going into primary care and internal medicine, family practice, which is the greatest need in our country. So this is creating a lot of problems and many more to come.
Well, Dr. Stevens, this is not even yet implemented, and part of this, it's kind of trickling out. So the fear has been created by just portions of it, and I guess a lot of it's the unknown. But what are you hearing from doctors in your association? What are they saying? Have they changed their perspective on this? Are they some willing to try it, or is the opposition to this growing?
Well, we have a variety of opinions. The vast majority oppose it. Some of our members, especially who are involved in care for the poor in the inner city, they see new funding for federally qualified clinics, which is helping them to reach out, do ministry, and take care of healthcare needs, and they like that part of it. I think the thing that people need to understand is we need healthcare reform, but we got it wrong with what was done with Obamacare. The biggest problem in health care is not access, and that's what the Obamacare bill was all about. Any patient that gets sick in this country is not going to die on the street. They can go into any emergency room in this country, and they have to be treated by law. Now, that's not the best solution for their health care needs, but what the government said is, no, we have to give insurance to everyone. What the biggest problem in health care is cost. What we've done is give discounted tickets to people to get on the Titanic of health care. And we're now 17% of the gross national product. It's going to be 25% by 2025, 50% if we don't do something. And cost is totally out of control. So physicians are concerned about that. At the same time, primary care, 50% of them think it's going to force them out of health care or make them want to leave. Many of them think their salaries are going to be lowered. People are going to be telling them how to practice medicine. They're going to be spending more and more time with bureaucracy and not getting the satisfaction of why they went into healthcare, to help people.
Let me ask you, Dr. Stevens, is there concern about the mandates that would violate the right of conscience, as we've seen under just recently, where religious organizations required to provide contraception as well as abortifacients? Are there concerns in the medical field that they might be forced to engage in certain procedures or practices that violate their conscience?
The biggest concern among Christian healthcare professionals in this country is right of conscience. 45% of my members say they have been pressured to compromise their conscience already. 25% have actually been denied a promotion, educational opportunity, or position. One of my staff members' wife is a family practice doctor in Texas. She did not believe she should give contraceptives to unmarried girls. The university she worked for found out it and said, listen, you have 1 week to change that practice, so you'll lose your job, and we'll put it in the physician registry, and you'll have trouble getting a job anywhere else. Anesthesiologist in South Carolina comes in on a Saturday morning on call to do pre-ops. There's a lady that was scheduled for a dilatation and curettage, goes up and talks to her, and she says, oh, no, it's not that, it's abortion. Didn't the OBGYN tell you? When he raised the issue with the OBGYN, they went to the hospital, and he almost lost his job from the board and from the medical director in the hospital. These are real issues, and 95% of our members and nurses, pharmacists, and other Christians in healthcare say they will quit medicine before they violate their conscience. What happened with Obamacare was tremendous power was given to the Secretary of Health and Human Services without any protection for healthcare providers, and what she may decide needs to be done. The contraceptive mandate is just one example of that.
Well, Dr. Stevens, thank you so much for joining us, and I greatly appreciate your insight into this issue, and I assure you we'll be back in touch with you to have you on again next time.
Pleasure to be with you, Tony. God bless.